Assalamu alaikum doctors, welcome to my YouTube channel MBBS and BDS lectures. Today is the fifth video of revision course of oral and maxillofacial surgery, which is very important for NLE, MDS, NBD as well as for BDS students. In this video we will discuss about dry socket or alveolar osteitis, which is most common, and this is very important for NLE exam, because this March NLE exam most of the scenarios was come from dry socket, and we will discuss about what is dry socket and what are the signs and symptoms, predisposing factor, prevention, management. Now what is alveolar osteitis, and the second name for dry socket is alveolar osteitis, you should remember. Now blood clot, how dry socket occur or alveolar osteitis occur? Blood clot does not form in socket after exodontia, or it gets dislodged. Mean when we extract the tooth, after that there is blood clot formation, but in dry socket or alveolar osteitis, blood clot does not form in the socket after extraction, or it is dislodged. Now the predisposing factor which dislodge the clot are the number one, traumatic extraction; number two, patient do not follow instruction like excessive mouth rinsing, dislodge the blood clot; third, smoking, which produce negative pressure, which dislodge the blood clot; fourth is the oral and contraceptives, female which use oral contraceptives; and fifth is the poor oral hygiene or active infection like pericoronitis. Now come to the sign and symptoms. In sign and symptoms, there is a severe radiating pain. The tooth socket appear empty with a partially or completely lost clot plus exposed bone, very sensitive to touch. There is a bed odor plus bed test. This is the point. Bed odor and bed test. And surrounding gingiva is swollen and inflamed. There is an enlarged lymph nodes in the neck. Now come to the after sign and symptoms. Now come to the prevention. Place cold pack for 10 to 15 minutes after every 4 to 6 hours after surgery in the first day. Pain start to increase 3 to 4 days after extraction and last for 7 to 10 days. Now the dry socket is a self-limiting condition, plus healing of the socket will occur even without treatment, but it will happen slowly. Now in management is to reduce pain during healing. If no treatment is provided, the only thing is that will happen is the patient will continue to have a pain. And in treatment we do irrigate socket with a saline. Then second step is, the steps are 7. First, irrigate the socket with the saline. Second, do not curate the socket, mean curettage of the socket. This will increase exposed bone and pain. Third, apply iodopalm gas inside the socket, and iodopalm or Alveogel, which contain eugenol, that reduce pain. Fourth, dressing is changed every day or every other day for 5 to 6 days until pain decrease. In each dressing change, irrigate the socket and the pain will be decreased. Discontinue the dressing when pain decrease, because it will slow down the healing. The fifth step is ask the patient to use hot saline rinses, mouth rinses. Number 6, give paracetamol or ibuprofen per pain. And 7, systematic involvement or immunocompromised patient need antibiotics, which is metronidazole from 200 to 400 mg 3 times daily for 5 days. This is the about management. Now if pain after extraction up to 3 days is normal, but pain increase after 3 days is a dry socket. This is all about alveolar osteitis or dry socket. Now today our topic is complete. If you like my video, press the like button and share this video with your friends. If you are new to my channel, subscribe my channel by pressing the red subscribe button and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.